Hi, my name's Stephanie, and today I'm going to talk about vitamin D deficiency and its effect on athletic performance for my IRB proposal. Vitamin D is known as a fat-soluble vitamin and is produced in the skin from exposure to ultraviolet radiation. Vitamin D helps the body absorb calcium, and its major role is in the nervous system, immune system, and muscle systems. Almost 77% of the population is deficient in vitamin D, and the average adult requires at least 2,000 international units per day. This was recommended by the Vitamin D Council. While vitamin D is limited by diet, it is also limited to indoor activities, time of day, age, season, and race. And vitamin D is a big problem in the United States, and deficiency in this vitamin has a major effect in neuromuscular and muscular functions in the body. Vitamin D, as I said, has many functions. There have been few studies that have been shown the relationship between vitamin D and athletic performance. Some sources of vitamin D include breakfast cereals, milk, tuna, salmon, orange juice, peppers, avocados, mango, sweet potatoes. And supplements for vitamin D are vitamin D2, which is known as calciferol, and vitamin D3, cholecalciferol. As for deficiency, there is a range for blood serum levels of vitamin D. The causes are not enough vitamin D in the diet, poor absorption within tissues, not getting enough sunlight, medications that interfere with the absorption. And most of the people who are at greatest risk are adolescents, the elderly, and people who have limited exposure to the sun. And a deficiency can lead to bone disease such as rickets, heart disease, autoimmune diseases, and cancer. And it's hard to detect a deficiency because most symptoms go ignored: depression, broken bones, pain and excessive swelling, sweating, and muscle weakness. As you can see here, this chart kind of shows what can happen with vitamin D deficiency and its consequences. Like I said, malabsorption deal with Crohn's disease, cystic fibrosis, bone diseases such as osteoporosis, osteoarthritis, rickets, autoimmune diseases, type 1, MS, Crohn's disease, cancer such as breast, colon, and prostate, and pancreatic cancer as well. Now, I've come across many articles that say different things about how much vitamin D do you actually need. And here's a kind of a list of recommended international units of vitamin D. However, this is not a set number. These numbers may increase because people may need more due to where they live, or their race, or their age. Toxicity of vitamin D is not very common within the food sources. If one is toxic in vitamin D, they might have no appetite, they might be going to the bathroom a lot, become nauseous, or hypercalcemia. Now, what functions vitamin D plays in the body? Some of them are important ones are bone health and calcium absorption, insulin secretion, muscle contraction ability, and it may increase one's mood, and this vitamin D does help increase kidney function. As for its role in muscle function, the vitamin D receptor is in the nuclei of muscle cells, and vitamin D has been known to affect muscle contractility, not only contractility, but also muscle stabilization and muscle strength. For a literature review, Pierre found elderly who are deficient in vitamin D have lost muscle, and then he gave a short-term supplementation for women older than 70. It found that it reduced their body sway and reduced their number of falls over a year period. Deci did a study with 139 patients who were 65 years or older and had a history of falling, and had a randomized control trial and they received an oral supplement of 600,000 international units of calciferol, which is vitamin D2, and they found that supplementation not only helped neuromuscular function, but not muscular strength. Lips and associates found that a supplement of vitamin D for 1 year for patients in a nursing home, and they were given either 400 or 800 international units of vitamin D per day, and it was found that 400 units per day improved vitamin D status in elderly people. Larson, Meyer, and Associates found that maintaining vitamin D status may reduce stress, fractures, inflammation, and impaired muscle function. Close and Associates did a study and found that 30 athletes in randomized trial put into 3 groups, a placebo or 20,000 or 40,000 international units per week of oral vitamin D3 for 12 weeks, and they did functional testing and found that both 20,000 international units and 40 international units increased athletes' vitamin D levels, but they did not increase their performance. Lovell and Associates did a study with 18 female gymnasts between the ages of 10 and 17 years old. They were assessed for their vitamin D and calcium intake. 15 of them had levels below recommended guidelines for bone health. 6 had vitamin D levels that were less than 50. 13 of them had calcium levels below recommended intake. And then they discovered that athletes who perform indoors should be assessed for vitamin D and calcium levels. And lastly, Willis and Associates discovered that 19 endurance athletes between the ages of 19 and 45 had a blood serum over 50% did not have recommended vitamin D levels that were adequate. And vitamin D deficiency is an epidemic with outdoor athletes as well, not just indoor, and more studies are necessary to help prevent insufficiency of vitamin D. As for limitations of the study, one of them would be the athlete's diet. Being a college athlete, not all of them are going to comply with eating all vitamins and minerals that they should. There are different forms of vitamin D. However, for this study, we're going to be using vitamin D3. The size of the study is pretty small, so that will affect the numbers. Oral supplementation is going to be a key thing in the study. Maybe if there was a dietary implementation that would be improved. And we're only recording measurements for short bursts of energy, like skating and hockey or sprinting and basketball. And athletes who compete indoors that require more stamina and endurance, such as indoor track, long-distance runners, or long-distance swimming, their fitness tests would be different. My hypothesis is providing a higher international unit of vitamin D will improve athletic performance. And my question is, will providing a 2,000 international unit or 5,000 international units of vitamin D help improve athletic performance? The objective is to determine if providing vitamin D of a higher amount will help improve performance, and it's to demonstrate that increasing one's vitamin D that will help improve performance. As for my method of study, I'm going to recruit both UNE's men's and basketball and men's hockey teams. Blood serum, vitamin D levels, medical history, and dietary intakes will be collected. 2 groups, one on each team, randomly assigned to a treatment of either 2,000 or of vitamin D or 5,000 international units of vitamin D3 per day. We're going to follow up the measurements every 2 weeks for 2 months. Athletic performance will be measured by a 20-meter sprint for the hockey team and the basketball team by a vertical jump test. Results from both serum vitamin D levels and fitness performance testing will be compared. Subjects will be required to fill out vitamin D questionnaire asking them if they get enough sunlight, they outdoors enough, do they eat enough vitamin D, yogurt, milk, eggs, fish, and they're required to provide a medication list because sometimes absorption of certain medications will interact with vitamin D. and the scores from both groups will be evaluated using t-tests with the G-Power software. A priority test using one-tailed t-test and an effect size of is 0.5. Subjects are athletes of the UNE's men's and hockey's basketball team. We're going to screen the medical history and their lifestyle. Participants are 47 male athletes at UNE, ages 18 to 24. Exclusions would be pre-existing conditions such as heart, kidney, substance abuse. Injured athlete, one who cannot perform fitness testing due to broken bone or fracture, or an ill athlete because of the body's immune system is too weak to be at full potential for this study. The setting will be at the University of New England's Biddeford campus. It is more convenient for subjects because they're student athletes and they'll be living on campus. The athletic training offices is where the blood testing will take place, and fitness testing will take place in the gymnasium of the sports complex. As for subject confidentiality, researchers will agree to store and handle the research data, and the data will be stored under a protected computer. Students will be provided a form of consent and researchers will adhere to the Belmont report. The results for the study, we hope to find that subjects receiving the higher dose of vitamin D3 will have increased serum vitamin D levels, and vitamin D will increase the athlete's muscle strength. The most important thing is how vitamin D is essential to one's diet. How I would contribute to the field is that physicians and athletic trainers at the school will be more aware of how being deficient in vitamin D will affect an athlete and their performance. A regular screening for vitamin deficiencies may become a thing for student athletes, and an emphasis on athletes having a meal plan rich in vitamin D to optimize their performance may become a standard at UNE. And there are my references, and thanks for watching.